Hi, my name is Hannah Marshall. I'm a criticalist here at DoveLewis, and today we're going to be talking about rattlesnake bites. So this is my dear friend Georgie. She unfortunately got bit by a snake a few days ago. While it's a relatively uncommon sort of disease that we see in the Pacific Northwest, it absolutely does happen in the Portland metro area. We honestly are usually getting animals that have been bit by a snake out in the gorge. So usually they're maybe an hour or two away out hiking, enjoying the nice sunny weather, and come across a rattlesnake. The most common variety of snakes that we have in our area are pit vipers. So there are over 200 species of these in and of themselves, and there's a lot of different other types of snakes that can cause other various toxicities, but we're going to be primarily referencing the pit vipers since that's what we're most primarily exposed to in this region ourselves. So most common snake bites are going to be to the face or extremities, mostly because animals are rooting around, sniffing, and don't really know what they've come across until it's hit them. Every now and then you can abate a bite if you hear the snake first and can get your animal back, but again, most of the time these guys are out hiking or somewhere off leash or roaming, enjoying life, and then they just get bit. The most common indicators that your pet was bit by a snake or your patient was bit by a snake is going to be first, you see it, you hear it, and you see the bite that happens. A lot of the times, though, you might not see the actual interaction, or you might never actually see the snake. And so from there, you're going to see 2 punctures is the most common thing that you'll see wherever the animal was bit. Yes, sometimes you can absolutely just see 1 puncture, so just 1 hole doesn't completely eliminate the likelihood of a snake bite, but definitely look for 2 bites. Again, look at the face and legs. Usually these are extremely painful, and they'll be really painful really quickly. And so redness, a little bit of bleeding, the bite wounds, and then really rapid swelling with pain. Once an animal's been bit, ideally they get to a veterinary hospital as soon as possible. We most commonly like to get them started on antivenom within the first 4 hours of their actual envenomation period. If you have a patient that comes in and you're not 100% sure, there's a couple different indicators on our lab work parameters that we look for to start. So the most common profiles that we get would be a chem CBC, a PT-PTT to look at our coagulation, and doing a blood smear. You'll often see a really high hematocrit, so they get really hemoconcentrated really quickly. They can be coagulopathic to start. Basically, the venom toxins can affect the coagulation system as well as your different blood systems, so they can have thrombocytopenia issues and other clotting disorders throughout this. They can also get secondary azotemias from rhabdomyolysis. They can have hepatic injury from the same. They can have a few electrolyte disturbances. But the most common, especially right when they walk in on triage, is going to be a high PCV. And then if you look at your blood smear, you're going to see type 3 echinocytes, where your red blood cell just has really fine spikies all throughout. That's really one of the most classic ways. So that's one of the best things to look for if you aren't 100% sure. If you see those, yes, it can be associated to a few other things, but if you have all of these signs come together and you see the echinocytes, that's one where I feel very confident that this has likely been a snake bite. So once that snake bite has occurred, basically the progression of treatment goes through stability. So pain medication, ideally to start with an opioid. Most of these animals end up needing to be on something pretty strong, like a fentanyl CRI, but usually we dose them with a methadone to start. Getting them fluids to start. They can often be febrile as well, but essentially getting them either a fluid bolus if they seem like they're in any state of shock, or just starting on IV fluids. You want to have some caution as they can have an extra dilutional coagulopathy if we're giving them too much IVs. And then again, getting that antivenom on board as fast as possible. There are a lot of different varieties of antivenom, and so essentially what your hospital stocks is what you have and what you use. Most animals need 1, maybe 2 vials of antivenom throughout their stay. Again, usually we're doing it within the first 4 hours, but there are some patients that have a delay and they require additional antivenom after the fact. There is also a very specific venom-induced coagulopathy that can occur where they actually need to be treated with more antivenom over plasma. And these animals, if they start to show coagulopathy as well as indications of bleeding, the more plasma you get them is basically more fuel for the fire. So if you're starting to see prolongations in your PT and PTT, that's when we just need to give them more antivenom. Thereafter, it's essentially just pain support, watching your bite, and getting them through the next couple days. Most of these animals are in the hospital for anywhere from 2 to to 4 days. We watch for the AKI signs. They can also have pigmenturia in their urine, kind of related to the rhabdo. Keeping them on IV fluids, giving them nutritional support as needed, keeping the bite nice and clean, dry. They don't normally need antibiotics. We keep an eye on the bite because we can start to see tissue necrosis, and depending on the area, that can get pretty large. However, that is a relatively uncommon complication. If it gets really necrotic and needs debridement, etc., is normally when you're going to start them on antibiotics. Going home, you're going to want to keep them quiet for multiple days. The swelling is going to be persistent for quite some time. It can be even up to 1 to 2 weeks until we really start to see them balloon down back to their normal size. As you can see with Georgie, she has pretty significant bruising and some swelling around her cheek that has actually improved drastically from her time in the hospital. You can also see a bit of a cyclic change where their swelling will start and then it will balloon up really significantly and then start to come down. So their swelling might not be the worst right from the start. So if it starts to look worse even 2 days after the fact, it doesn't mean they absolutely need more antivenom or different treatment. It's just a manifestation of time to watch them recover. Most of these guys recover quite well, especially with quick and prompt treatment, and that is rattlesnakes.